Good afternoon, everybody. My name is Noureddine Kenssous. I've been working for CLCH for about 7 years now. I have about 3 roles. I have 3 roles in CLCH. One is a senior librarian. Second is a patient information officer. And the third one is an interim NICE guidance implementation as an interim. My presentation today is about introducing a monitoring system, an IT monitoring system for NICE guidelines. So it is about an IT platform to support the implementation of NICE guidelines and quality standards. And we have heard today many presentations about clinical guidelines, quality standards, communication, quality, patient care. It's all within this framework of NICE guidelines. I'm sure everybody is familiar with NICE. It's nice to be nice. The NICE Institute, the National Institute of Health and Clinical Excellence. And NICE produces monthly guidelines and quality standards. And it's the duty of CLCH to implement NICE guidelines, or at least to have in-house guidelines that support patient care. So today I'll be talking about, I'll share with you ideas about the aim of the innovation program, this innovation initiative, the background of it, the objectives, and the drivers behind, the policies and the drivers behind the program, as well as the outcomes, what we would expect to get out of the system. Sorry. So our aim from this innovative initiative is to provide a facility to improve the trust position on dissemination, implementation and monitoring of NICE guidelines and quality standards by providing a single central information system. At the moment, which is the background is the current situation, is that the communication and the recording of the processes of the NICE implementation is scattered between different databases and spreadsheets, which makes it difficult for the trust to monitor our status in terms of compliance. Are we green, amber or red? So my proposal, after speaking to professional leads, clinical leads, and the NICE core group, clinical reference group, it's become apparent that there is a problem in terms of monitoring and in terms of recording all these processes. So last year I was involved, or I project managed successfully the procurement of a library management system. And this library management system was very efficient in managing all the recording and communication between the library and the users. So it was proposed to the NICE core group to adopt this system, tweak it, and use it as a reference system or as a management system for these processes. After I've spoken to the suppliers of the system, it became apparent that it is possible to do that at a cost, obviously. The alternative that I've put forward to the core group, our medical director, is to develop an in-house system by involving our IoT teams, maybe to use SharePoint as alternative, or create an access database as alternative. So I invited the suppliers to come in and do a presentation and give us a more time about how the system works for NICE guidelines and the time frame that they would deliver such a system, the cost of it. For once, the option that's been endorsed in principle by our medical director is to go for the external provider. The why is because it's quick to deliver. It will be delivered within 8 weeks. The cost is minimum compared to the risk of the CLCH in terms of compliance. It's £12,000. If we commission it to the IoT team, especially how they are at the moment, the IoT team, it might take longer to implement or to develop a new system from SharePoint. So, and these are objectives, is to create this facility from the external. Sorry. Facility from the external provider scope of it and the quality of it is to provide an easy system for our clinical professionals and clinical leads to handle, because our clinical professionals are very busy and they need facilities or systems where they can provide feedback, provide responses, assessment fairly quickly and easily, as well as their communication with their clinical teams and services. It will be easy for them to monitor the clinical team's feedback in the system. So it would be owned by the clinical professionals, so to speak. The drivers for this system, or for even NICE guidelines itself, there are so many policies around to justify the implementation of NICE guidelines. The midst that the Lord does is report the requirements for the CQC as an assessment requirements for trust to be compliant. The NHS litigation authority. So there are loads of drivers, as well as our local driver is the CLCH vision for quality. So we put quality at the heart of everything that we do, and to deliver services that we are proud of. In terms of implementing NICE guidelines, we will be delivering on the quality. And the goals as well is to be innovative in technology and in technology pioneering. So, and there is the prospect of the NICE guideline, the system, is that we will be the first trust to implement such a system, and there is a commercial potential for embedding this system, such a system. So the outcomes that we expect is to have a robust cockpit view. It's like a plane. We see how our status very clearly, where these services are compliant, they are red, non-compliant, or partially compliant, they are amber or red, and how we can rectify this to make it green and fully compliant. And if we are partially compliant or non-compliant, what action plans are in place, and how we can audit them, that the action plans have been actually delivered. And the NICE guidelines is evidence-based practice, and the CLCH is try to get the clinical delivery as a evidence-based practice, and the NICE guidelines are at the top of the evidence-based hierarchy. And when we implement NICE guidelines and we are compliant, we will have a consistent patient care. So if, for example, I'm diabetic, if I go to CLCH for diabetes care, I would have the same care as I go to Luton and Dunstable. So and we will have the same quality standard across the NHS. And that is the end of my presentation. Thank you very much. Any questions?
Noureddine, thank you again. I was surprised when you said that no other trust has created a similar platform. Have you had a look?
Yes, I've had a look at NICE websites.
Yeah.
They have a database for learning practices.
Yeah.
And other trusts, they have adopted access database. And another trust in up north, they've adopted SharePoint. But they adopted SharePoint as a web platform rather than a kind of monitoring tool. Is a communication kind of platform, which potentially we could do that with the external provider. Then they would give us a web platform that we can adopt the platform to include not just the monitoring, but the communication, and create a community of practice kind of platform where clinicians can interact with each other.
So if I can follow up briefly, so your sponsor is Dr. Jo Mentos, our medical director, you referenced her a couple of times in your presentation. Through her and her colleague Fritz, who I know you work closely with, we'll have connections to two things. The clerk that asked me to unpick that acronym, I can't do it properly, but it's a group that coordinates research projects and tries to drive innovation across the whole of the Northwest London sector. And they have access to funding. You may want to think about where we access that. More interestingly for me is the whole input to the Academic Health Science Network as well, which is just forming the Northwest London one with Imperial College, sort of as a vantage point, so the Imperial College partners that it's referred to. That again is also trying to ensure that all the best practice that's known, and in this occasion to be nice, is spread through. And again, worth thinking about logging what you're doing with those organisations, so that we can think about whether there's a wider position. You talked about commercial potentials to this as well.
There was a NHS regional funding scheme, and it's apparently from Joan's feedback on that is that it's not possible because it involves an external provider, and they hold the intellectual property to the platform. So we could negotiate with the external provider as we are the guinea pig. It's not. We might negotiate a discount on the system.